Welcome, everyone, and thank you for tuning into this episode of the Hawaii Retirement Show. Super excited to be able to talk about the basics in Medicare. Before we kick off, Jason, how are you doing today?
Doing good, Paul. Happy to be here for another episode.
Yeah, totally. So in this episode today, we're going to be talking about Medicare. And just, in a future episode, we're going to have a great guest speaker to share a little bit more. But just today, we're going to talk about some of those basics. So, Jason, why don't you kick us off?
Yeah, so I guess we'll start off with I looked up what Medicare.gov, which is a great, excellent resource, government website. It's trusted. So I looked up how they define Medicare, and this is what they had. They had Medicare is the federal health insurance program for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease.
Oh,
So yeah, so there are some younger people due to unfortunate circumstances that have access to Medicare. But by and large, the age that we look for is 65, right? That's the magic number. I think everybody knows that. All of our listeners probably know 65 is that magic age for Medicare.
yeah, absolutely. And so when did Medicare get started? So that's something that is really intriguing. So it actually got started in the 60s in 1965. The president at the time was Lyndon B. Johnson, who signed a bill that basically brought Medicare and Medicaid um, to allow Medicare program that will also include Part A and Part B, which again, we'll get into Part A and we'll get into Part B and things like that.
Right.
But then there was actually in 2003, which I actually didn't know it was actually that recent, was when they actually created another policy, which was Medicare Prescription Drug Improvement and Modernization, which actually brought in Part C and Part D.
Right.
Which again, we'll talk a little bit more about those things. But yeah, that was pretty intriguing. That was only like 20 years ago. So that's kind of crazy.
Right. That is pretty interesting, right? There was no, integration with these Medicare Advantage plans prior to 2003. And that doesn't seem too long ago, but I guess that's 20 years now. But yeah, program's been around a long time, 1965.
Yeah.
And it's really a critical program that helps a lot of people in this country, and we pay into it. People say Medicare Part A is premium free, but that's in large part because we're paying into it throughout our working
Working career.
careers, right? And that's also how you qualify for Medicare, is you need to pay in through so many quarters in order to qualify. So it's kind of, it's not just, so there's we might as well touch on it now. There's Medicaid and Medicare, right? So if you don't qualify for Medicare, there are ways to still participate through paying certain premiums. Medicaid is not what we're talking about here. Medicaid is it's a program designed to help people with, a lower threshold of assets and resources.
Mm-hmm.
But yeah, it's a great program. Medicaid, Medicare Part A, the premium is premium free. We pay into it throughout our working careers, and then Part B, we it's not premium free. You're going to pay, and what you pay is determined by something called IRMA. Paul, you want to tell us a little bit about IRMA?
Yeah. So IRMA is related to income. So it's the income related monthly adjustment amount.
Mm-hmm.
So IRMA. So this is basically um, what the government puts into place to figure out and calculate what your certain levels of your premium will be. So for example, like if your income bracket is really, really high, meaning
Mm-hmm.
you're earning a lot of money in retirement, typically your premium is going to be higher, right?
Right.
And if you're someone that has maybe on the lower brackets of
Mm-hmm.
income, you will have lower premiums due. So this is definitely an important thing to pay attention to,
Sure.
especially if you are going to take a large distribution for something specific. We would want to know how those things might impact your moving forward uh, IRMA, or the premiums you'll have to pay.
Right. Yeah, and I
Yes,
think I think we'll dive into that a little deeper on another episode. Just have a whole IRMA
for sure.
episode. go over the brackets and how, it's based on your income of 2 years prior.
Yep.
And then when you retire, it's a life-changing event. So it's not based on your income. There's a lot to IRMA that I think we should save for another day.
Right. No, absolutely, absolutely. And to this point, like there's a lot of planning opportunity when it comes to these programs. And it is something you need to sign up for and you're required to, but there is planning involved in those types of things, especially how things get impacted like this. But yeah, I think that's great. So, talked about what Medicare and Medicaid, the difference are. So let's just jump into, the parts. So Jason, tell us a little bit about Part A.
Yeah. So Part A is so it covers inpatient hospital stays, care in skilled nursing facility, hospice care, and some home health care. So I like to think of Part A as like the emergency part, right? Like emergency circumstances, Part A, hospital, Um that's kind of maybe a oversimplification of what it is, but that's how I see it. And then it's based on there's all these they call it like periods, right? Like it covers so many stays per period in the hospital, so it's not like it's an indefinite coverage of like hospital care or skilled nursing facility. It's a finite number. And maybe we'll touch on that in our talk with Donnie coming up here on Medicare. But Part A I like to just think of as, it's the hospital stays, the emergency stuff, and some home health care.
Yep.
Anything you want to add to Part A?
Well, I mean, I think that it's, I know that this is maybe not going to be something that is related to a lot of our listeners, but if you are someone who might not be eligible, maybe you didn't pay in enough, the premium free part of that, right? That would be something that goes away, and then you would actually have to pay into the system for Part A.
Right.
So it's not like you won't ever be eligible. So again, those people who might not had paid enough, you can pay for Part A, meaning like Jason said earlier, it wouldn't be premium free. Yeah.
Right. Okay.
Yep.
So part B is where we get into that's the IRMA part, right?
Yep.
And that's covering certain doctor services, outpatient care, medical supplies, and preventative services.
Yeah.
So a little less of the critical dire stuff, but still really important. Your outpatient care, medical supplies, all that kind of stuff is covered under Part B.
Yep. Absolutely. And, so this is now Part B is something that you will be paying for. And like Jason said, it's connected to IRMA so that those premiums get adjusted based off your income. But typically what happens is Part B is paid through your Social Security benefit, typically is what you see, right?
Right.
Now, again, you don't have to start Social Security at the same time you start Medicare or vice versa. But typically what you see that getting paid through those Social Security benefits.
Yeah, no, that's a good point. Glad you brought it up. How Medicare is actually paid for is typically for vast majority of people is through their Social Security benefits.
Yeah, absolutely. So yeah, Part C, I don't know about you, but I feel like this is something that Donnie does a great job explaining in the coming episode on, her Medicare basics. But yeah, Part C is the Advantage plan. So it's something that you basically will be able to opt into, right? Or something that you'll have to go out and get that coverage. Typically, this is going to be from, a private company. This isn't necessarily from the government, but it's something that you're getting as an add-on. And it was interesting to note that you're typically going to get a Part C or a Part D. You won't be getting both. And that was something that I thought was really interesting that Donnie pointed out. But yeah, by and large, Part C is something that includes other services that Part A and Part B do not.
Yeah, and I think as we get going here, we'll probably touch on what Medicare doesn't cover.
Yeah.
And then once you know what Medicare doesn't cover, then you can kind of understand why some people opt into this Part C, the Medicare Advantage, right?
Absolutely. Yep. And, I guess just to close it off and maybe go there and here in a moment, but Part D, D stands for drug, right? So this is going to be, medications and prescriptions and different things like that. Again, that wouldn't be covered in that Medicare Part A or Part B services. So this is, again, similar to like the insurance you have now. It's something that you pay extra premiums for. But again, if you need these things are part of that Medicare benefit that you add on.
Yeah, prescription drugs. Oh, it's so expensive. I mean, I can't imagine having to pay out of pocket for a lot of that stuff.
Right. No, absolutely.
So how Medicare works with other insurance. So a lot of our workers might have, if they're state or they're federal, they're continuing their insurance, right? And I think the main thing we want to get across here is that there's always going to be one primary payer and then a secondary.
Yeah.
And so the role of the primary payer is to kind of take the lead and pay the cost, and whatever isn't paid, the secondary comes in and pays what the rest or whatever they're authorized to pay.
Yeah. Yeah, I think an important note, especially for our listeners, in the federal and the state of Hawaii side, by and large, if you work enough years of service, you're going to get some sort of medical coverage, right? And when you get into this retirement age, or you get into that 65 year old, you will be opting in or signing up for A and B, but under a very limited circumstance would you actually choose Part C or Part D, because your medical from the federal government for the state covers this part of it.
Right.
So it would definitely be a decision to go in a different direction for you and your families. But by and large, that, as we understood it, most people who have enough years of service that get coverage from their covered by their employer would go with that instead.
Yeah. And there's just so many different types of plans, and everybody's unique needs are specific. Even if you do have coverage, maybe your spouse doesn't. And
Yep.
I definitely think we're not Medicare specialists by any stretch,
No.
right? It's always good to go to these, whether it's Donnie, who we're going to have on the next episode, and Premier Benefits Consultants. There's Boomer Benefits. There's Medicare.gov has a lot of resources, but yeah, it's definitely good to talk to somebody and do your own research, because there's so many different decisions you can make, and each one's unique.
Absolutely. And I think this is a great part to talk about what's not covered in Part A and Part B,
Sure.
just because I think there's a lot of big opportunities to just be aware of that. I didn't know that wasn't in there. I better get this type of insurance, whether it's sooner or later, right? So why don't you talk a little bit about some of these things that aren't covered?
Yeah, and I like to highlight the biggest one is long-term care, right? Because long-term care, it's such an important planning item, especially for people like me and yourself when we work with clients, because it can be such an asset depleting event. If somebody needs long-term care for a long time, it's just the costs are so high. Medicare doesn't cover that. And so it's definitely a high consideration. I'll just run down the list of some other things. Most dental care, eye exams for prescription glasses, dentures, cosmetic surgery, massage therapy, routine physical exams, hearing aids, concierge care. And then let's see, covered items or services you get from an opt-out doctor or other provider. So outside of, your emergency, So pretty much that's where, your Medicare Advantage plan could come in and help cover some of this stuff.
Right. Or just maybe even a general plan that you have set up before you retired, right? So maybe you have long-term care insurance, which we'll definitely touch on in the coming episodes. Or maybe you just, you might have other types of coverage that do these different things. But like we said, by and large, if we're working for the state of Hawaii as a teacher or, Pearl Harbor or something like that, there is some sort of coverage for you, right? Based off of years of service, and they'll pay for those premiums based off of years of service, which again, we'll get to those types of things. Sure. But yeah, by and large, I would definitely want to highlight, like Jason said, long-term care is not something that is covered in Part A and Part B, and is definitely a critical piece to be planning for.
Yeah, no, absolutely. And yeah, this is just a little intro to Medicare. We're not going too deep on anything, but the following episode to be released is a talk with Dani Suga, who all she does is Medicare, and we'll go a little deeper. And then maybe in future episodes, we'll dive in and maybe break down some different topics, such as IRMA, or, you know, the different options for federal and state workers as they enter retirement.
Yeah, absolutely. So with that, thank you guys so much for being with us on this episode. Just a basics into Medicare. Hope that it was a value add to you, and have a great day.
The opinions and statements presented on this show are for general information only and are not intended to provide specific advice or recommendations. Never make any investment or financial decisions based on information offered on this show without first consulting your financial, legal, or tax advisor. All economic and performance information mentioned on the show is historical in nature and is not indicative of any future results. All indices mentioned on this show are unmanaged and cannot be invested in directly. All information is believed to be from reliable sources. However, we make no representation as to its completeness or accuracy. Lastly, all opinions expressed by Jason Cutitta, Paul McWilliams, and any guests on the show are solely their own opinions and do not reflect the opinions of or are endorsed by ToBA Financial or Inspire Advisors. For Jason Cutitta, investment advisory services are offered through ToBA Financial LLC, a registered investment advisor offering advisory services in the state of Hawaii and in other jurisdictions where exempt from registration. And for Paul McWilliams, investment advisory services are offered through Inspire Advisors LLC, a registered investment advisor with the SEC.